Yes, good morning and good afternoon. We are back for our next video about tooth eruption. In this video, we shall talk about tooth eruption, the types, the phases, theories, and shortly about resorption. If you have not subscribed, please I encourage you to subscribe, share the video and like it. Thank you. We are defining eruption of tooth as an occlusal movement of a tooth from its position in the jaw to the position in the oral cavity. It means the tooth was in some place. It was in developmental position. We talked about when you talk about odontogenesis, it's not the same as tooth eruption. Odontogenesis is the formation of a tooth. Formation of a tooth happens or takes place between 6 and 8 months intra-uterine or before birth. But tooth eruption, it is the movement of a tooth from one place to the other. What are we talking about? We are saying the tooth, if at all this is our jaw, we have position A and position B. We shall have the movement of a tooth from position A to position B. That is the eruption we are talking about. Or we can even have our jaw and we shall have 3 positions. We have position A, position B, position 3. We have A, B, and C. So we can have movement of a tooth from one position to the other. Even if it is from here to here, it is also movement. So it is also eruption. And from here to here, from B to C, it is also what? Movement. As we shall see in our discussion. What is the active eruption of a tooth? We are meaning the tooth is moving or it is making distance from one place to the other. In other words, it is making tangible movement in terms of distance from one position to the other. That is the active movement facilitated by movement of what? Of a tooth. However, like I discussed in the previous lecture, where we said we can sometimes have what we call gingival recession, where the gum recedes or moves below the cement enamel junction or below the gum line. When that one happens, it is also called a passive eruption because the roots of a tooth are being seen or the gum is exposed, is moving down and exposing the root of a tooth. It is also called a passive what? Eruption of the tooth. Let's go to phases. We have phases. We have phases of tooth eruption. Phases of tooth eruption. We are saying these are made by both permanent and deciduous teeth within the jaw. Like we said, if I thought this is A and this is B, if we have any movement of a tooth from position A to position B as it is coming to C, the movement from A to B, this is pre-eruptive. In other words, it has not yet come into the oral cavity, but the movement is within the what? The jaw tissues. So however much it is not seen in the mouth, but it is taking movement from one place to the other, or from A to B. So that is what we call before eruption, but within the what? The tissues. We have the eruptive. Eruptive, we are saying, it starts with initiation of a root formation and is made by the tooth movement from its position in the jaw of the jaw to the position in the oral cavity. Now from B to what? To C. Eruptive. So we shall come by defining it now. We are by saying we are having movement of a tooth from B to C, or movement of a tooth from its position in the jaw, where we are not seeing with our eyes, to the oral cavity or the mouth, where we are seeing with our eyes. That is eruptive phase. Thank you. What of post-eruptive phase? Post-eruptive phase, this one is a phase which takes place at a later time of the individual. For example, this is made, as we have stated here, to compensate for tooth wear or space. For example, drifting and supra eruption. What are we talking about? We talked about the positioning of teeth, what we call articulation. When we have teeth which are arranged like this, these are upper and these are lower. When you remove one tooth, for example, you remove tooth X, we are going to, let us first describe drifting. When tooth X suffers, maybe due to trauma or due to dental caries, and you lose tooth X, what happens that this tooth is going to, the neighboring teeth are going to compensate this one by drifting. Drifting means they're growing closer to this space to close it. So this one, somehow after some time, you shall see this space reducing. If you have ever lost a tooth, you can see after some time you shall find this tooth reducing. So by this type of movement, it is what we call drifting. They are coming in, the teeth are growing to close this space. By doing this, we shall at a later time see the disadvantage of this, because it is creating space. It is creating space around here and around here. It is a type of movement made by teeth. So that can compensate for this place where there is no tooth which was lost. However, it may not be advantageous. It is instead disadvantageous, because it's going to cause positions of retention of what? Of food. That is drifting. So in other words, you can define drifting in the layman's language as the bending of a tooth in a place where a tooth was extracted, or in a place where a tooth was removed to compensate for the lost tooth. So we are still on tooth X. We had tooth X, and we are saying when it is removed, what happens? Apart from drifting, we can have what we call supra eruption. Remember, all these are movements of a tooth that are taking place post-eruptive, or after eruption of all the teeth. That's why we are saying post-eruptive movements. What is supra eruption? Supra eruption, we are saying if X has moved up, the body does this supra eruption to compensate for this space. So what happens? It will a bit by doing this, it will grow longer. Supra eruption. Supra. This one is very bad. Supra eruption, the tooth is going longer. By doing that, it is losing support here in the jaw or in the periodontal ligament. And also, apart from that, if at all it is, for example, an upper tooth, and it's an upper tooth, or even if it is a lower tooth, but this super erupted tooth is traumatizing a soft tissue in the oral cavity, we can develop something like traumatic fibroma. This is not a good type of tooth movement. Post-eruptive movement, where a tooth grows longer. The moment maybe it keeps traumatizing the tongue, or traumatizing the palate, or soft tissue, we can develop into what? Traumatic fibroma. Traumatizing the lip, the tongue, or the cheek, that movement can develop into traumatic fibroma, which is very bad. Let's keep on eruption. So those are eruptive phases. So what is the importance of these teeth? We are saying these teeth are important because they maintain space. Usually, people will come, parents will come and say, remove all these primary teeth. Maybe just because they have dark spots on them. Just because they have dark spots, they shouldn't remove them. What is the reason for not removing them? The reason for not removing them is because primary teeth are very important. You need to maintain them clean. The reason is because they maintain space. They maintain space for the permanent ones. For example, if this is a 5-1 and this is a 6-1 and this is a 6-2, this is what? This is a 5-2. The moment you lose this one prematurely, a 5-1, and this one prematurely, due to dental caries, and you lose them, it means that in this, when the first tooth appears, the permanent tooth, that is maybe a 1-1. When the 1-1 comes and finds here there was a 5-1, a 6-1, this is a 5-2, 6-2. When the 5-1 comes, whether a 1-1 comes, it will come and can grow into such. And the other one who comes also go into this. It means the 1-1, the permanent lateral can come and do this and also do this. They are growing in the positions where are not supposed to be, or in a wider what? Area. It means the canine which will come later will have nowhere to be. Instead can now what? Remain up here. So what we call malignment. This one is not good. So primary teeth are equally important to maintain space for the permanent ones. Facial appearance. A child needs to look nice, or you can say beauty. We have speech. We talked about the importance of teeth because we said teeth they also allow pronunciation of certain words, what we call phonetics, pronunciation of words, Sarah, Mississippi. All these ones are very important. So when you lose the teeth, when a child loses teeth, he may not pronounce these words very well. Another one, mastication. The importance of mastication, we define mastication as the physical breakdown of food. So that's the moment the food reaches the GIT or the stomach and the other parts, it can be broken down now by enzymes. But we need the physical breakdown. So if at all the child does not have teeth, it means that he's not going to now digest the food well. That means we shall have a problem with digestion of food, where we can even result into malnutrition. What are these eruption dates? We need to know the eruption dates because it is very important. It is very important for us to know these eruption dates. Someone will come ask you this importance of primary teeth. Do not forget. What is the eruption dates? These eruption dates are not static, or in other words, they are not fixed, but these are approximate. It means that sometimes children can grow, can have these teeth before or after, but this is the approximate or the generalized type of time when you expect these teeth to be in the oral cavity. Number one, we have the central incisor. And the central incisor, when a child is 6 months of age, we expect them to have the central incisor. Central incisor, we talked about that. As the tooth, which are in the anterior part of the mouth, the central incisor just from the midline. It means that when I talk about the central incisor, I also mean what? The lower ones. But I put the note that the lower ones grow before the upper ones. So it means that we can have this one first, and later, after a few days or few months, or few weeks, we can have also what? These ones. Lateral incisor. The lateral incisor, we have it at 8 months. So we can also have it. The next one will be a canine. A canine at 1.5. But 1.5, it means that after some time we shall have to wait a bit before having a canine. But at 1 year, 12 months, we shall have the first molar. The first molar. At 6 months, 8 months, so at 1 year, we have, then at 1.5, then at 2 years, we have. This is the primary dentition. We said someone will have this primary dentition from 6 months approximately up to 2 years or 2.5. That's what we talked about, primary dentition. So a child needs to have these teeth until the age of 7, when the others are developing. Rather are erupting, not developing, are erupting. Note, the lower ones will always erupt before the upper ones. When we come to permanent teeth, we shall have the central incisor at 7 months. But what is the first permanent tooth to come? The first permanent tooth to appear into the oral cavity, or to erupt, or to appear in the oral cavity. Remember what we talked about eruption as the movement of a tooth from its position where it is developing in the jaw, the position in the oral cavity. The first one to appear is going to be the first molar. And always in your questions, they will be asking you, which of the following appears first? The first molar. So, after the second one will be the central incisor, the lateral incisor will follow, the lower canine will follow upper canine, like that. For the premolar lower at 10 years, 9 the upper. The premolar, the lower one, 11 years, the upper one, 10 years. The molar, 12, 13 years. The last molar, that is the wisdom tooth, we said it comes at what? At between 17 years and 25 years. That is the wisdom tooth. Those teeth are very important. It is very important to know the eruption dates, because during we shall look at something like what we call pericoronitis. Pericoronitis. When this one is developing, we shall find some flap developing here and sometimes causes some signs. We shall talk about it in the next video, where we need to know eruption dates of these teeth. When the other one is shedding, you need to know the time when this one is what is being formed. For some procedures, for example, if at all you have to do maybe root canal treatment of primary teeth, you need to know when these ones are supposed to erupt, so that you do not do it when a time has already reached. But if at all you know a tooth, for example, is supposed to develop, to erupt at 7 years of age, and the baby presented to you is 3 years, then you can do pulpotomy to prepare the tooth for these 4 years. But in case a baby is 6.5, and you know this one is appearing at 7 years, you don't need to do what? Pulpotomy. For when you reach at pulpotomy and treatment of primary teeth, we shall talk about that one in details. But for now, I'm trying to express the need of you to know the importance of eruption dates. We are having what we call resorption. What is resorption? Resorption, we are saying, when we are looking at differences between primary and permanent dentition, we talked about this one briefly, and we said this one is the physiological melting away of the roots of the primary tooth. So here we are saying resorption is the natural process by which primary teeth are melted down to give way of permanent teeth. Remember what we talked about, that our primary teeth, that the crown are bulbous for molars, and they don't have a trunk. They don't have a trunk, and they are also roots are what? Are divergent. You remember that? So we are saying, in order to give way for this, there is always what we call what we call resorption. And what causes resorption? Resorption is the melting away of these ones. If at all you have ever removed a primary tooth, or you have gone to remove a primary tooth of either of your younger brother or your child, you shall find the teeth of the roots are almost melted away, or as small as this. Why? This is because of this natural process called what? Resorption. Because we are saying we have 3 forces. The force number 1 is masticatory force, or the force of an individual biting. As somebody keeps on biting, this one is one force created, masticatory force. Another force is of erupting tooth. Then the last one is this one, edging of this what? Of these roots. All these ones combine to weaken this one, and is melted away to form what? This melted away tooth. Or this is what we call resorption. And this one is natural. It is a physiological process. That is why among our differences between primary and permanent, we said for it is physiological for primary teeth to have resorption, but it is pathological, or it is a pathology for you to find such in a permanent what? Tooth. We put NB that for a tooth to grow or to erupt in an individual, we shall find that for any tooth to appear in the oral cavity, it is always going to be 2/3 of the root mature. 2/3 of the root, 2/3. For all teeth except canines and mandibular what? Molars. It will take more 3 years for the root to fully mature, what we call the apex to form, what we call apexogenesis, to form for a tooth that is in the oral cavity. So, for example, we said the first molar will appear at 6 years. So it means that for us to have a fully mature root with the apex formed, it will be 3 plus 6. So we have it at 9 years. If at all a tooth has appeared at 7 years of age, it means at 10 years is when we shall expect the fully mature what? Root. It may appear in the mouth with the crown, but the root is not yet what? Mature. When we are talking about treatment of primary teeth, we shall explain more on that. So we are saying that one is exception for canines and what? And molars. Very important. So we are on theories of tooth eruption. We have theories of what people think happens as we are saying we shall have movement of a tooth from its position in the jaw, from the position in the jaw, the position in the oral cavity. So, what happens? One scholar gave a theory we call root growth theory, and says the crown is elevated by a thrust or a force by the developing root. It means that if at all we have this is our jaw, the tooth which is developing, the force, the thrust for developing root, there is a force in the root that will push it from its position here to the position in the what? In the oral cavity. That is root growth. As this root grows, it creates a force that will push it. That is what we call it root growth theory. It is a force which is created in the developing root that pushes it into what? Into this position in the oral cavity. We have another one called bone growth. Bone growth. Bone growth, there is what we call bone deposition. So this one states that there is always bone deposition between the developing tooth that pushes the tooth into the what? Into the oral cavity. That is bone growth theory. Then also we have pulp growth, or rather pulp proliferation. This one, it is assumed that under the cell there is always what we call cellular division, or at the basal part of the what? Of the pulp, that creates pressure that pushes the tooth into what? The oral cavity, that is the what? The mouth. Those are three. The next one, they are talking about pressure-freed theory. It is also called blood pressure theory. This one, it is the scholar documented that there is an increased blood pressure within the alveolar bone or within the ecosystem where this tooth is. That as the blood pressure increases in the position where this tooth is, it pushes it, it creates pressure that pushes it into the what? Into the oral cavity. Then the last one is developmental or periodontal membrane. Periodontal membrane, in the periodontal membrane, we shall have to remind you about the tooth. The tooth is having its head in alveolar bone, and these are periodontal membrane. There are fibers there. The periodontal membrane, we have interradicula from one root to the other. For this one is from the tooth, the alveolar bone. We have the apical fibers. We have the ones towards the crest. So all these forces, all these, there's a force that thrust, that creates a pressure that pushes these fibers up. So this creates traction of components that pushes the tooth into the oral cavity. Thank you so much for watching. Please subscribe, share, and like the video. Thank you.